Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Jess Osipka. Today's guest is RN Adrianne, who works at a rural critical care facility in Gunnison, Colorado. Adrianne completed the IONRP in September of 2024.
Thanks so much for spending some time with me this morning, Adrianne. It's so great to see you, and I can't wait to kind of hear how things have been going since you've completed the residency program. So let's start by just having you introduce yourself.
My name is Adrianne Meyer. I currently work in Colorado at a rural critical care facility in Gunnison in the middle of the mountains. I've been at this facility for a year and a half. I came here as a new grad.
What type of unit are you working on?
I was working on our med surg unit until actually this last week. I started my official orientation to labor and delivery. Our facility only really has those two units and an ER. So officially cross-training over to the other unit, which is very
Awesome.
exciting.
Congratulations. Yeah, that is very exciting. That's one of my favorite things about working in our smaller facilities. You get opportunity within your organization to sort of learn some different things and float to different areas. So I love that. Congratulations.
Thank you.
So I'm curious if you can talk a little bit about how you applied the concepts that we covered in the program to your first year of nursing practice.
One of the concepts that really stood out to me and that I think I'm still using very often was the communication, especially our SBAR with providers and things, because we talked about it in nursing school, but it's very different when you're actually in the role and not in the class. So I think the skills and tips that we learned for that was really helpful, and I still use that when I have to call doctors at 3 a.m. in the morning and have all the things ready for that. So
Yeah, calling doctors at 3 a.m. can be really intimidating.
yeah.
Even after a number of years of practice, it still can be intimidating. So I love that. That's great. Can you talk a little bit about your professional experience?
My professional experience, I did a change project. I focused on the self-bias that we have towards individuals with substance abuse problems, alcohol addiction, things like that. I had noticed at our facility we had gotten some individuals who their chief complaint was regarding substance use or alcohol abuse. And I noticed that often in report and things, some of the wording used and opinions voiced weren't beneficial towards the patient care. And I just wanted to educate our staff on how our self-bias can impact the care that these patients receive. So I did some education for the staff. I did a pamphlet and had the staff read over it and ask questions, and was just gave them the opportunity to learn about self-bias in that realm.
I feel like that was a passion of yours for quite a long time. I think even as we talk about bias and our implicit bias in the program, and I don't know if that sort of stemmed something for you, but I feel like that was just a passion of yours. And I love that you brought it to your staff to raise awareness because it happens. And just like you said, it doesn't give anything to the patient care. So let's take a step back and educate ourselves on these biases. Sometimes we don't even know that they're happening. So
Yeah.
in our small communities, we see sometimes the same patients come in for the same problems. So I commend you for taking a kind of a tougher topic and going forward with it. Is there anything aside from the communication in SBAR that you found to be most beneficial for an aspect of the program?
I thought, especially during that first year as a new grad, the well-being exercises were really beneficial. Just to like take a step back, and it wasn't necessarily focused on nursing practice, but more ourselves, which can be kind of easy to forget about when you're so focused on learning all the things that come with being a new nurse. So taking the time to focus on yourself amidst all of that was really beneficial for me.
I love those exercises too. Every time we introduce them, to our residents. Sometimes I'm like, oh, I'm doing this one really well, and this one I probably need to work on a little bit. Kind of ebbs and flows. And I think this time of year, especially with all the holidays, we're all so busy. I think it's a good reminder to take care of ourselves too. Is there anything else you would like to share with current or future residents?
I think it's easy for this to become just another stepping stone, but it's really important to really take the time to do the activities and do the things, because I've been done with it for 4 months and I'm still thinking about the activities we did, especially the well-being ones, and it's really been beneficial. So taking the time and not having it just be another step in that process is really good.
Thanks so much, Adrianne. That was really insightful, and it's just really great to hear. Sometimes it feels like we spend so much time with you over this year, and then we're like, all right, see ya, good luck.
Yeah.
We're here if you need us. So it's just so nice to visit with our former resident.